Hi, I'm Dr. Mehta, Program Director of the NASS-Accredited DOC Sports and Spine Fellowship. Our fellowship is focused on those that are interested in either academic or private practice setting. As a fellow, you'll get exposed to the clinical research side, specifically looking at how pharmaceutical industry trials are being conducted, as well as learning the business side of medicine, which can be helpful in whether you're starting a private practice or joining a private practice, and helping you, get the skill set you need to thrive in that practice. Currently, we take one fellow per year that works side by side with myself, as well as the other providers that we have in the practice. A fellowship is an opportunity for you to learn the interventional pain side, but more importantly, for you to develop your own skill set and confidence to help you once you're in attending. At the fellowship here, we really provide a hands-on approach. So from day one, you're doing procedures and really getting an understanding of the diagnosis, the procedures, and the complexity of what we have to offer. And then we help guide you on that independence, help coach you through problem solving, critical thinking, so that when you are ready for your next career, your next job, you feel very equipped with the tools that you've learned in this fellowship.
My name is Ryan Smith. I am a former fellow of the Dayton Outpatient Center Interventional Sports and Musculoskeletal Medicine Fellowship.
Hi everyone, I'm Dr. Shruti Amin, and I get the honor to say that I was part of the first graduating class of Dayton Outpatient Center for Musculoskeletal and Interventional Spine.
My name is Dr. Medea Khan, and I am an Interventional Pain and Spine Fellow at DOC Pain Management.
So why did I choose NASS versus ACPE? Initially, I applied to both and I compared them. I really wanted more of a higher volume of interventional experience. I think NASS offers that. It also offers ultrasound teaching, and it felt more of an extension of my pulmonary residency.
I chose NASS because of its strong reputation for hands-on training. I really enjoyed the variety that the programs offered. So from one program to another, the curriculum was vastly different. And on my away rotations, I was able to look and see and find a program that aligned specifically with my future career goals.
It was a really impressive mix of high procedure volume, but also efficiency. I would get very, very good procedure numbers in the fellowship. I would also finish most days around 4 o'clock, so it wasn't having to stay late at the clinic or in the surgical center as well. So that was something that was really I really appreciated. I do have a family, and I was able to do both. Spend some time at home, spend a lot of time, and good numbers still at the fellowship.
I really like the one-on-one teaching environment. I think with other programs, when you have multiple attendings, you can oftentimes get lost with the different teaching styles. So with one attending just teaching you, it helps you just stick to one way of learning and build your own procedural style and confidence in your procedures.
I really enjoyed the fact on my away rotation that there was a wide breadth of procedures that were offered. So everything from standard spine injections all the way to more advanced training, including Intracept, mild, SCS, DRG, and peripheral nerve stimulation. We also added on SI bone fusions, and there's a whole separate department for vein as well, which we treat endovenous reflux and with endovenous nerve vein ablation, as well as Varithena procedures.
Dayton Outpatient Center had the option to do sports medicine with the men's and women's Dayton soccer team. So that was a big pro of the fellowship, that I had the opportunity to do sports medicine and see athletes as well as interventional spine and chronic pain. So a little bit more experience in both of those options.
I found that being as part of a private practice, I found it very helpful to get training in not only clinical side, but also seeing the business and operations side of medicine. And I found that made me much more confident in feeling comfortable going out into private practice settings.
One thing that really helped me with this program, with the real world, is the opioid teaching. I think it was very unique that I didn't really see that in any of the other programs. And I knew for the real world, that's something that you really need to learn and that you really shouldn't neglect in NASS programs. Dr. Mehta, he really teaches you everything from reading MRIs, if you're, want to present at a conference, you know how to read it, to running a C-arm, learning ultrasound. And I think that really helped me in the real world.
The main draw would just be that there was a lot of options for things to do with family. Like there's Columbus, like they have a great zoo. Cincinnati has a great zoo, and you're kind of in between. So that was really good for my family. There's like a kids museum there. There are lots of restaurants, lots of places to go out, lots of parks, lots of amazing parks in Dayton, and very hot place for pain as well. There is a lot of pain practices in the area, and it is a place that you have a lot of talent, like especially nationwide.
I really like living in Dayton. I was in New York City for about 3 years, and it was nice to get some peace and quiet and be able to study and sleep without so loud noises for a change. I enjoy the patient population. They're super grateful. Some of them come from a rural area, so they're very grateful patients. I would say that there's always something to do, and if it's not in Dayton, you can just go to Cincinnati and see FC Cincinnati soccer games. You got the Reds, the Bengals. There's skiing in Indiana. It's not too far. Leading fellowship, I was left with great practical skills, great mentorship, and strong interventional skills that I used in my everyday practice. And I felt very confident just going into practice with the same style that I had in fellowship and just pulling that forward into my everyday life. So yeah, I had a really great experience and I'm very grateful for it.
Congratulations. You've chosen an amazing specialty, very rewarding interventional pain. We hope we can provide you with the skill set and the fellowship training to be future interventional pain leaders. Thank you for listening. We look forward to meeting you in person and then hopefully teaching you down the road.